Life on your stomach. Sorry. Kidding.
Listen.
April! Did you inherit the wind?
You would have only done that to me because everybody else would have just punched in the nose.
Well, they haven't for 20 years.
And I'm sure you've done that to all your patients.
I've done it to the ones that I knew would laugh.
I never want to hear patient care from you again.
It made my patients laugh.
See how he treated you?
Very well. Thank you.
Still don't know what I'm doing, so not that well.
We already finished the exam. We're just going over them now.
I know. You would be someone I'd have a conversation about when I went to lunch. I can't tell you her name, but that patient for the upper GI. Okay, so right anterior oblique. So that
I
same.
will not donate myself to do this for the lower GI because he's gonna make it horrible. Okay.
Okay, so bring this arm down by your side. Bend this knee up towards your chest a little. There you go. Turn your body. Yep, just about there. So it's a little steeper depending on the patient's body habit. It's 40 to 70 degrees for the RAO for the stomach, okay?
47 or 40?
40 to 70.
Oh, I don't know how old I was. The 40 is good.
So we're going to center midway between the spine and the upside lateral border. That is our side to side centering, okay? Our up to down, 1 to 2 inches above the lower rib margin. So we're going to get her centered, not exactly.
Okay.
So we're going to get her centered there, side to side first. Then I'm going to feel the lower rib margin, tickle, and 1 to 2 inches above that, okay? The thing that will trip you up is this oblique or shooting the patient PA. Some of you, I promise you, will center on this side. Which side of the body is the stomach on?
This side. I mean,
Left side.
oh.
Left side.
I know. If I was looking at a patient, it would be on that side.
Patient. Quiet. Left marker. The lower corner, okay? 10 by 12 lengthwise. That could change depending on what you see in the radiologist imaging, okay? Maybe you would do it crosswise if their stomach is very horizontal, okay? But again, for the purposes of our lab, 10 by 12 lengthwise, leave it open to the full 10 by 12, okay? Question? Yes. Cool? Make sense? Clear as mud? Love it. PA, go all the way flat for me. She was shielded, you saw it.
Yeah. Slap it on me.
Same centering, we're going to find that lower rib margin 1 to 2 inches above and center between the spine and the lateral border of her body. Okay?
What do I do with my arm?
You can keep them there, that's fine. Drop that left marker in the corner, okay? Since we're only seeing the left side, it is not acceptable to use your right marker here, okay? The stomach is all on the left side. We are centering on the left side. The only marker that's correct is the left marker, okay? Let me have you lie.
And that's all for all this lower? No.
No, because now you're going to lie on your right side for a right lateral.
Why would it be? Why?
It shouldn't be, April.
I know. I got that.
If it's worthwhile.
I got that a couple
Arms above your head. Bottom of the cassette at the level of the iliac crest. Centering a little forward from the mid-coronal plane. Why would I center a little forward from the mid-coronal plane? Stomach is not exactly, dead center. But center just a little forward from the spine, about right there. Okay? Drop a right marker. It's a right lateral, right marker. Okay? And make sure that she's nice and lateral. Questions? And now we'll have you lie flat on your back.
Oh, I was just looking.
You're good. Which side of the body is the stomach on? Left. So we're going to center 1 to 2 inches up from the lower rib margin, centering on the left side, okay? Left marker. This is the trap of imaging the upper GI, that switch, knowing the difference, okay? Make sure you mark it correctly. Take that extra 5 seconds, okay?
What marker did you use?
Left marker, because I'm only seeing the left side, basically. And then LPO. So bend this knee, your right knee, and kind of turn your body a little toward your left side. This time I probably will give you a little sponge.
Okay, let's just pretend I'm shielded.
You're good. So about right in there. You can relax back.
I need one of these for at home. This is
I know, right? It's nice. How do I know? Because I have one at home.
Order them online. All the pillows
You can.
go
They're like
this.
$30. They're really great. You're not going off the table. Don't
Why
worry.
do you think you're not close to the edge?
You're good. Never thrown anybody on the floor yet. Except for that one guy. Don't ask about him, April. Bottom of the cassette at the level of the iliac crest. And centering on the left side where the stomach is living, so partway between the mid-sagittal plane and the lateral border of the body. Okay, and because this is the left side, yoink, dropping my left marker in that lower corner, okay? Or you could put it in the light on the table, okay? You sure could. Okay? Questions? That's the LPO. So this is going to keep that contrast in the greater curvature and the funness of the stomach. Sorry? Marker can go right there, or it can go right there on the table, okay, as long as it's in the light.
Where do you put for the central ray?
Sorry?
The central ray?
Central ray is going to be between the mid-sagittal plane and the lateral border of her body. Bottom of the crest is where the crest is where the bottom of the cassette should be. Okay? Questions on any of that? Easy peasy? Lemon squeezy. Thank you, April.
You're welcome. Oh my goodness.
I did the AP. Yeah.
Sorry.
You're fine.